Heart disease is the leading cause of death in the United States of America. And when we think about that, when we break it down even further, we're looking at 800,000 people having a heart attack each year. Around 600,000 is their first episode. This equates to about 1 in every 40 seconds someone is having a heart attack. Sometimes it can be even scarier, 1 in 5 don't even know they had one. This is known as a silent heart attack. But with heart disease, with heart attack specifically, one of the biggest symptoms is chest pain. So the big question is, when is chest pain concerning? When do I, as a cardiologist, when am I concerned when someone is coming in with chest pain? Categorized, we put chest pain in different categories: typical chest pain, possible chest pain, and non-cardiac chest pain. So typical chest pain, what exactly is that? Chest pain that's here mid-sternal, sometimes radiates to the shoulder, can be associated with symptoms such as shortness of breath, sweating or diaphoresis, lightheadedness, dizziness, nausea, vomiting. Pain that's worse with exertion such as running, jogging, and pain that is worse also with stress. A third component is pain that gets better with rest or medication called nitroglycerin. If you have all three, I am concerned that your chest pain is secondary to something from the heart. Now, if you have 2 out of the 3, you can have what was previously known as atypical chest pain, but now we'd like to call it possible chest pain. The reason we want to stray away from atypical chest pain is that we do understand that some people, specifically diabetics, kidney disease, or women, can present with these atypical presentation, but actually have chest pain. So if someone is having any type of pain or discomfort, what can we do? We will get further testings with an EKG. This will let us know how the heart is doing electrically. And if you're having a STEMI, ST elevation myocardial infarction, this is an acute emergency. We will also get some blood work to help to confirm these testings, such as a troponin level, but everything relies on a good history and physical exam. If you have an abnormal EKG, concerning history, abnormal blood work, we're concerned that you're having a heart attack, we're taking you to the cardiac catheterization lab for an urgent procedure. But if your pain has resolved or the EKGs are normal and blood test is also normal, then we may do further testing such as an echocardiogram, an ultrasound of the heart, or even a stress test where we try to see that under stress, if you're having any of these symptoms, to help understand your chest pain a little bit better. If that is abnormal, then we will proceed with a cardiac catheterization to look for blockages. Now, if you're not having any of those symptoms, doesn't mean that we will not work you up further. It just means that we have to also include other potential causes of chest pain. This includes things like costochondritis, which is inflammation of the chest, pancreatitis, issues with the gallbladder, issues with the stomach itself. Reflux a lot of times can cause chest pain and get people to be concerned for having a heart attack or heart disease. Inflammation of the heart itself, whether that's pericarditis or myocarditis, can also simulate that you're having a heart attack. So we take all the information, but everything always comes down to the history to help get further testings for the labs to evaluate you for potential causes of your chest pain, whether that's a heart attack where we need to take it to the cardiac catheterization lab, or something else where we need to work you up further with an echocardiogram or with a stress test. And if it's normal, then possibly following up with your primary care to look for other cardiac causes. So this is a simple way of my thought process of when someone comes in with chest pain, how I work them up to see if it needs to be treated acutely or we need to run other tests to see what the cause of the chest pain is. If you found any benefit in this, hit that subscribe button. But more importantly, watch this next video.